So I put this up specifically because I think it's very easy to identify what are some of the meat sources of iron, like chicken and fish and these kind of things. But some of the vegetarian sources I think are really important. So I think some of them are things that we commonly know about. So things like spinach, for example, broccoli is another very good example of a fairly high iron content compared to other foods. Tomato puree. And I put some numbers up in terms of overall iron content. Now, we talked about milligrams of kind of iron or how much is in there. So eating some spinach, for example, will give you 2 to 3 milligrams of iron. How much of that actually gets absorbed into your body? It's really hard to know, but that's the basic iron content. But other things that, so for example, tofu, lentils, so olive dal and things like that actually have fairly good amounts of iron. How much is absorbed, we don't know. But gives you some examples of different types. And in fact, a lot of our breakfast cereals, things like that, are actually fortified in iron to add a little bit more. Again, because there's some bran or some fiber and things like that in there, maybe they're not all absorbed. So when it comes to our thing, we try to measure people's iron levels to try to give us an idea of where do you fit on this spectrum. So are you anemic? Are your iron levels also low? And we talk about different ways of replacing it. So as I said, you know, the iron preparations can come in different varieties, and it really amounts to how much, you know, we're trying to replace or how much we're trying to get in. We're trying to maximize that intestinal absorption. And so, as I said, if we need about 15 to 25 milligrams a day and only about 10% of that is absorbed, really, when you look at all these numbers that are up here, so 30 milligrams of this ferrous gluconate, that's the elemental iron that you're trying to get in. And often we try to maximize that by asking people to take 2 or 3 tablets a day. And for some people, that's actually quite a bit, and they can't tolerate that, and I'll tell you why in a second. If you are taking iron pills, we also want to make sure that you take them in the right setting. So taking an iron pill with a meal, you actually have a difficulty absorbing the iron because you're competing with all the other things you're trying to absorb at the same time. So we actually recommend that you take them about an hour or half an hour before your meal, and try to take it with something, as I said, acidic. And the ideal thing is probably orange juice. So we try to aim for sometimes 3 doses a day, and not everybody tolerates that. And we try to give a good trial of that before we think about things like bringing people into hospital to give them intravenous iron, because sometimes that's the only way that we can really replace one's iron. Iron supplements come with a lot of side effects, though. There are some people who tolerate that very high iron content supplement without any issues at all. I would say the majority of people have one of these symptoms, right? So nausea is a very common one. Iron is hard on the stomach, and as a result, it causes the nausea. Heartburn can also come through. Constipation is probably the most common side effect that we see. So having, you know, if you are taking iron supplements, you know, it's always good to make sure that that your bowel habits don't change, or that you're keeping on top of. And rarely we do see people get diarrhea as well. Again, it's all changing your normal absorption or increasing the amount that you're not getting through your regular diet. So we're going to change gears a little bit and talk about vitamin B12 deficiency. And it was interesting. I was trying to figure out how, you know, with any of these anemias and the different causes, it's really hard to figure out how much of the population is susceptible to any of these. And one of the things I did just out of curiosity was, you know, type it into Google and say, well, what's the most common reason that Indian people are anemic? And one of the things that came up was actually B12 deficiency. And they say about probably, this is an article written in Times of India that actually said about 50% of Indian people are B12 deficient. And there's actually probably a really good reason, and that has to do with what are the sources of B12 that we have in our diet, and why is our diet probably not healthy. So again, we need vitamin B12 to make our blood cells. Many of the foods that are rich in vitamin B12 are animal products. So eggs, meat, poultry, fish. And so as you can see, if you have a diet that doesn't have these things in them, you're very much more easily to get into problems with B12 deficiency. Again, vegetarians who don't eat any of the products are more likely to get it. Elderly, partly from changes in how well their intestines absorb a lot of nutrients and process them in the body, can have deficiencies in this. And it tends to be that as we get older, we tend to eat less and maybe don't cover all of the different groups of foods that we should over time. And again, because it's only found in animal foods, a lot of different companies and things have actually gone, or governments have said, well, we should add these into different other food products so we can try to increase some of the amounts that people are getting through regular food. So again, as I said, people who avoid meat products or animal products can look at alternative sources, and one of the big alternative sources are soy fortified products, which are often added with vitamin B12. But about 10 to 30% of older people may not absorb it as well as they used to, and there's actually different causes. So one of the causes that we all get taught about, but we don't see a lot of as much anymore, is something called pernicious anemia, where you actually have an autoimmune problem where your body doesn't have what it needs to absorb a lot of these vitamins, and this is something that can develop at any point in your life. So that could be one of the causes that develops. But Health Canada actually advises that adults over the age of 50 actually need to eat more fortified vitamin B12 products because of change in absorption that they have over time. And as a result, a lot of the cereals that we eat, or breakfast cereals that we eat, actually have added vitamin B12 in them. But what are some of the other kind of causes? As I said, not eating enough foods is kind of the main one. Eating foods with them, but your body can't absorb them, either because of this pernicious anemia problem or because of other changes in your absorption. One area that we're seeing more and more people have issues with changes in their absorption or how well their intestines get vitamins is people who've had any kind of bowel surgery, had parts of their bowel removed, for example. And other medical problems, so you might have other diseases or other autoimmune conditions that may predispose you. Besides just the anemia alone, this is actually an area where we don't tend to see this as much, but back probably before all these cereals were added or fortified with vitamin B12, we used to see people with neurological problems, so numbness or tingling in their hands or their feet, trouble walking because of changes in their neurological system because of vitamin B12 deficiency, mood changes as well, and memory problems. The tough part with any of these is that there can be multiple other causes of these things as well, and we tend not to see the severe. These are usually associated with fairly severe B12 deficiency over years, and we don't tend to see that because of the supplementing in our diet that we do. So generally the requirements are not very high. So on average, whether you're a man or woman, regardless of real age, you need about 2 to 3 micrograms of vitamin B12 a day. And I'll show you in a second how you can get that in. Unlike iron, there's actually no upper limit, meaning that if you absorb more, you take in more, you supplement more, there's really no downside necessarily to it. So different things. So unfortunately, as I said, fruits and vegetables, grains don't have a lot of them unless they're added in afterwards. But a glass of milk has about half of your requirement right there, aside from other benefits that you'll also get from it. A cup of yogurt or 3/4 cup of yogurt can contain that. So things in our diet that usually are there. Eggs are actually a pretty high source, but there's also other things like soy products, as I said, because of their adding in afterwards, or things like cottage cheese. So other animal products that are not necessarily meats themselves can contain enough in them that most people will get enough in their diet. So the main way we treat it, usually oral supplementation. So most people, even if you have intestinal problems absorbing it, as I said, these come in supplement sizes about 1,200 micrograms. You only need about 2 or 3 micrograms. So you're really giving much higher doses than needed. So even if you absorb a 10% of that, you're still getting way more than what you need on a daily basis. But we also give people B12 injections as well to try to supplement them. Some people, because of their intestinal issues, won't absorb as much. So we try to do other routes as well. But the main source is probably oral B12. And so usually the B12 injections that we give are about once in a month, and most family doctors will give those just to keep people topped up over time. There are also little intranasal sprays, again, getting rid of the absorption problem in the body, not kind of avoiding the stomach or the intestines altogether. Don't see that one very often at all. And finally, we'll talk a little bit about folic acid. So very commonly, if you have a deficiency in B12, we also make sure that you don't have a deficiency in folic acid. It tends to go together, even though the food sources can be a little bit different. Food folates really tend to be in leafy vegetables, those kind of things. And so it tends to be that people don't as easily get folate deficient. The normal daily requirements for normal individuals can be about 200 to 400 micrograms a day of folic acid. But again, other things can increase that. So we talked about pregnancy, lactation, things like areas where you need more vitamin on a daily basis. And it's actually one of the reasons, either partly because of normal neurological development of babies during pregnancy. Folate is actually very important, and it's actually included in all vitamins that we give them. So even if they can't take the full multivitamin, we give pregnant women folate for one of those reasons. Folate deficiency is actually less and less common now. And part of the reason is that a lot of our products are supplemented. A lot of our products are supplemented with folate. So for example, flour, which is actually a very common ingredient. So many things we actually supplement. So it makes this very uncommon. So what are some of the requirements? So as I said, anywhere from 400 to 800 micrograms a day. You can see that there's a stable low, which actually I find interesting because as a hematologist, we don't often follow that. We don't know what the downside necessarily is. For the most part, in healthy individuals, you don't need more than 1 milligram or 1,000 micrograms a day. So we don't often use higher doses than that unless you have an underlying hematological problem, like you're breaking down your blood cells and you need a bit more. Why do we say that? Well, the stores of folate in your body are actually pretty low. So you don't hold on and keep a lot of this stuff. So if you're, for example, breaking down your blood or something, you're making blood products really quickly, you actually deplete your folic acid stores very quickly as well. So it doesn't take very long to become deficient. In comparison to something like vitamin B12, your stores of that can be months. So it is a big difference between what the time frame of your anemia is and which can be the ultimate underlying cause. So as I said, some of the causes of folate deficiency, the body stores are very small. So the body stores are actually quite small. So as I said, 5 to 10 milligrams. This is why people get deficient. One of the most common reasons that we see people who have really bad folate deficiency is actually usually poor nutrition. So either you're just not eating enough, or for whatever reason your diet has changed, those kind of things. But you can actually become folate deficient very quickly just from not eating. Increased requirements we talked about. So pregnancy is probably the most common increased requirement state. But other things, like I said, breaking down your blood, which we call a hemolytic anemia, other skin disorders, things like that, that also lead to it. And also some drugs. So one of the most common drugs that we see that is used for example, treatment of rheumatoid arthritis is a drug called methotrexate, and it actually is designed to decrease the folate or stop some of the metabolism. But there's lots of other ones too that can change that. So we look for some of these things when trying to find out why. So I said drugs is another big area of this. So what are some of the sources? So as I said, green leafy vegetables is a big source. Oranges and orange juice, either from naturally having it or being fortified with it afterwards. Breakfast cereals, a lot of them have it added in. And you can get about 40 or 50% of your daily folate intake just from one bowl of cereal. So what are some of the other sources? I actually found this from a lot of these numbers from the Canadian Dietitians Society, who actually talk about different sources and things like that. And so they have lots of different ideas in terms of meat alternatives or different alternatives that people can get a lot of their sources. So different vegetables we talked about, so okra, spinach, lots of other green vegetables or leafy vegetables that have sources of it. Orange juice, as I said, pastas because of the fortified nature of a lot of our flours and things like that. But other sources, so dals, lentils, can actually have quite a bit of folic acid within them. And all kinds of different beans. And in fact, lots of beans or peas are actually very good sources of a lot of these nutrients in general. And so whether you have that in your diet or not. We do, despite that, sometimes need folic acid supplementation. I would say that the normal healthy population usually doesn't require it if you have a good diet. But there are some cases, as I said, whether it's pregnancy, whether it's different underlying medical issues that you may actually require it on top. So I'll kind of finish up a little bit, just summarizing. As I said, anemia for us is a fairly common problem. I've only talked about three different reasons, or three main reasons why people become anemic. And the reason I chose to focus on those is I think these are probably the three most preventable causes of anemia. And as you can see, most of them are actually preventable just through diet. And just being a little bit more aware of what I eat and maybe where I can improve my diet. And I think that's one thing that I don't think physicians are very good at telling patients, and we don't, partly because we don't have the time to sit down and take a full diet history, but I think there's a lot of information out there now in terms of different diets or different sources that you can improve upon that to help yourself. So I said the causes can be really broad, and so really we need to look at each individual case and try to figure out where is the underlying cause. As I said, diet is a big preventable area of this. And I put this in there as a caution because I think I see a lot of people taking a lot of different vitamin supplementations for different reasons. And I think many of them are good reasons, and it's because of what you've read and things like that. I think, as I said, folic acid, vitamin B12 usually have very little consequence of taking extra in them. Iron can actually have big consequences of taking a lot of extra iron in, some of which we know, most of which people don't run into trouble with. But I think it's always important to kind of talk about with your physician, if I'm going to take any extra products, if I'm going to take anything, just let them know exactly what you're taking and maybe why. I often find it helps to sometimes demonstrate. So for example, if you're going to be taking iron products and you're truly iron deficient, it's very important for us to know, have we made sure that you're not losing it from somewhere before you start on an iron product, right? Is it for sure just your diet that maybe is deficient in iron or sources of iron? And these are really important areas to try to figure out because there's other diseases that we have to look at and other things that we have to worry about.
Thank you. We have about 10 minutes for questions. Last 5 minutes, I want to give you the further follow-up of last seminar. People came to me afterwards about sugar. So some misunderstanding, misconceptions. I want to clarify in about 2-3 minutes. But before that, let's have some questions for Dr. Iyengar. Go ahead, please.
One issue which we have not addressed is the genetic issue. We can't blindly apply the Caucasian ranges to Indians.
You're right.
One of the problem is thalassemia. The thalassemic gene is more prevalent in India because of the Middle East occupation, whatever it be. Personal experience, I was put through the grill by the hematologist because my hemoglobin level is low, testing, doing all sorts of lumbar puncture and everything. Finally said I probably have thalassemia gene. Because that doesn't occur to the physicians here. But being from India, we have to keep that in mind while addressing Indians.
It's very important.
I think it's a very important point. I think you're going to find that in general, most physicians who train here now are different than 50 years ago. And why is that? Because 30% or 40% of our population is not Caucasian anymore, right? So we're seeing more of these diseases. I think our testing for those has changed a lot too, right? So our ability to test a lot of these things has changed. So I think where in the past we're more reliant on just blood counts and what blood cells look under the microscope, now we have a lot more testing to look for those things and look for some of these abnormalities, things like that. You're absolutely right. One of the things I didn't mention is people with thalassemia actually absorb more iron than the normal population.
Anand?
Would you comment on almonds, their quantity of iron content and also availability to the body?
So I said, I'm not sure about the specific amount. Generally speaking, nuts do have a lot of iron in them. Unfortunately, a lot of them will fall under this category of a plant-based source. So your absorption of a lot of those is actually going to be lower than compared to some of those other ones that I mentioned. So you might have, so it probably takes you a lot more to absorb the same amount. Having said that, there's probably, in terms of their high fat content, things like that, a lot of nuts, there's probably some downside to having those high amounts coming in as well.
Anand?
Is there a way to get a sense that you are deficient in, vitamins or minerals other than comprehensive testing, and just follow up? Is there a comprehensive test which will yield to you where you are deficient?
Yeah, I think it's difficult. You're right. I mean, we're very reliant on blood testing, especially as hematologists. I think we are. Our blood testing is also not perfect, meaning a vitamin B12 level is actually very difficult to interpret. There's many people who have normal levels who are actually quite deficient. And in fact, we don't do the other testing that can help us with that. I think as a general approach, I think, if you're wondering if you are, I think it's good, especially in certain age categories, after the age of probably 50, at least once a year or maybe every couple of years somebody has a blood test done. Because that's, as I said, that's an age population where you become more vulnerable to some of these things because your diet changes, your absorption changes. Is there a great system in place for that? Probably not, unless you're having specific issues or concerns and things like that. Sometimes we actually pick these things up on just routine testing as well.
If you will allow me a
Go
brief
ahead.
follow-up.
Go ahead.
You mentioned a number of different things that provide sources of, folate, iron, and so on. I always wonder if many of these foods are working, have synergies, which are really providing you far more than the amounts you simply say you get from a cup of yogurt or so on. And to that end, I individually I can go Google it and I can find how many vitamins, what's the mineral content. But nobody really say, okay, here's a group, you should have 1 or 2 things from this group, 1 or 2 things from this group, and so on, say 4 or 5 groups, then you will meet your requirements of vitamins and minerals. Does such a comprehensive chart or something exist somewhere?
It's quite difficult. The closest thing we have in Canada is the Canada Health Food Guide, which kind of roughly gives you an idea of this is how many of each category of things I should have. So whether that's fruits and vegetables, grains, those kind of things, or alternative sources. But you're right, they don't account for what happens if I combine things. What happens if I have a comprehensive meal, how much does that count towards my each individual category? It's difficult. I don't think there is a great one.
Let me
Thank you.
try to answer a little bit of it. As you heard, the doctors don't have time to give a dietary counseling. However, you talk to a dietitian, spend a little 10-15 minutes, they'll do it for you.
Yeah,
They
they often
definitely
break
do it.
down, they'll take your meal and break it down into different sources to try to figure out where you not getting enough and where you're getting more.
Thank you.
Question about the red blood cell count. You mentioned there's a normal range and some people tend to be lower. If you're consistently lower on that red blood cell count, I have a two-part question. Is there a long-term risk to that being lower than normal? And second, maybe I missed it, does the iron supplement or B12 improve that red blood cell count, or that's orthogonal to that?
So I think it's a good question. So, it really depends, for the first question, it really depends on where you are, right? So are you 5% lower than normal, or are you 50% lower than normal, right? So it really depends on how far you're off. The area that I was talking to that said if you're a little bit lower but you could still be normal is usually a very small difference between the normal range and that group, okay? So there's lots of different areas, lots of different issues that you could have that may cause you to be even lower, right? So it may not be normal as well, and that's where you have to see, sometimes it's the trend over time. It's not only the red blood cell count we look at the hemoglobin concentration, things like that as well. The second part, sorry,
Does the B12 and iron improve that red blood
so
cell?
if you can kind of say that the anemia is because of those things, it often does, right? Does it improve within days? No. Usually takes at least weeks to months for those to gradually go back up, because one, you have to replete what you don't have that you need to use on a regular daily basis. And then afterwards, what you're actually doing is building up your stores. So for in the example that I gave for vitamin B12, if you're really deficient in vitamin B12, we often start with either high-dose pills or injections to help build up the stores. As time goes on and the blood counts improve, the stores will get repleted as well, right? So over time, you should see that improve. But again, it really depends on what the cause of it is, which sometimes it's not always perfectly clear until you make sure that you replace all of these things, or those are not the underlying problems.
I'd like to thank Abhinav on your behalf. It was a great presentation. And thank you.